Healthcare is changing. Amazing new technologies give hope even to the most severely ill patients. And with that, how we deliver care is evolving. The Federal Affordable Care Act, and more recently, efforts in Washington to repair, repeal, or replace it, only add to the pace of change and uncertainty. In Maine and New Hampshire, we have our own unique challenges as older, more rural states. Amid all this uncertainty, one thing is clear. Healthcare systems across the country, including MaineHealth, must be willing to adapt to survive. Already, our community hospitals and local health systems face tremendous financial pressure, and many are struggling. Let's look at some of the national and regional trends that have led us to where we are today. The population of the MaineHealth service area isn't expected to grow much in the coming decade, less than 1%. But it will grow older. During the next 10 years, the number of people aged 65 and older in our region is expected to increase by almost 25%. With that aging population comes a greater demand for care and more complex cases as medical conditions stack up over the course of longer lives. Healthcare systems, including hospitals and physician practices, get paid through one of four ways. Medicare is the federal insurance program for people over the age of 65. Medicaid is a joint federal and state program that covers low-income populations and those with disabilities. There is, of course, private insurance, like Anthem or Aetna. And finally, there are those without insurance who can afford to pay their own medical bills. Ultimately, taxpayers and employers pay for the vast majority of healthcare delivered in this country. Medicare and Medicaid don't cover the full cost of delivering care to those patients, and that difference is made up with higher charges to private insurance and those paying their own medical bills. This is what is referred to as cost shifting. Also, our nonprofit hospitals are committed to offering care to all, regardless of ability to pay. So another expense borne by private insurance and self-payers is the cost of charitable care in our communities. The problem is, as the population ages and more people are covered by Medicare, a larger and larger share of that payment shortfall has to be billed to private insurance and self-payers who are struggling with those higher costs. And when Medicaid is either cut or not expanded, as was the case in Maine in recent years, that means more charitable care to cover as well. Within MaineHealth, each of our member hospital and health networks stands on its own with this mix of payers. While members can pool resources for things like purchasing, the way the system is set up now, our community hospitals each must find a balance among those four sources of revenue to pay the bills. That has worked up to this point, but recent trends are making it hard to deliver care this way. For one thing, fewer procedures are taking place at our community hospitals. In fact, in 2015, 20 Maine hospitals, including 4 MaineHealth members, performed fewer than 2 inpatient surgeries per day. That's partly because many relatively simple procedures are now being done in outpatient clinics. But it's also because more complex procedures are being done at larger, specialized medical centers that are able to invest in expensive new technologies employed by highly specialized providers. And here's the problem. Traditionally, surgeries and other complex procedures have provided much of the revenue our community hospitals needed to stay open. Now that money is going away. Meanwhile, large specialized hospitals like Maine Medical Center are seeing growth. By 2015, more than 70% of all inpatient surgeries in Maine were taking place at just 5 hospitals. A similar trend is present in New Hampshire. Now, it is true that some of the smallest hospitals, those with 25 or fewer beds, qualify for federal designation as critical access hospitals and get paid more favorably by the government. This has helped these small hospitals better weather the changes. But this advantage is now eroding and is not expected to shield them from the long-term trends. And for nearly all the other community hospitals in Maine and New Hampshire, the losses are mounting. This financial pinch isn't the only challenge for our local community hospitals. They've taken on the mission of providing primary and secondary care and addressing community health. This is the right approach for patients, but the healthcare system doesn't reward hospitals for doing it. Add in the all-too-common challenge of recruiting good doctors, nurses, and other clinicians to rural settings, and it becomes clear that help is needed for our local health systems to survive. The good news is, as a system, MaineHealth is in strong financial shape. Dollars have migrated from rural to urban, from small to large hospitals, but those dollars haven't gone away. Our challenge now is to figure out how to allow those dollars to flow back into the communities in order to support the care local communities need to stay healthy. That is something that can't happen if each member is a freestanding, legally separate entity. And we've got to do this in a way that keeps the community in our community hospitals. At MaineHealth, we have as our mission, working together so our communities are the healthiest in America. That means delivering the right care, at the right time, and in the right place. That's our commitment to you, and that's why it's so important we all work together to find the right path forward.